Each year, about 700,000 people experience a new or recurrent stroke, the nation's third leading cause of death. On average, someone suffers a stroke every 45 seconds and someone dies of a stroke every 3.1 minutes. Stroke is a leading cause of serious long-term disability in the United States, with about 4.7 million stroke survivors alive today. Here to educate us on the signs and symptoms of stroke is Marlene Besnoff, Stroke Program Specialist with West Florida Hospital. Thanks for being here.
Thank you, Jeff.
Well, before we get into stroke, I want to publicly congratulate you on your 2010 Clinical Excellence Award. I understand this is really something for people who have made a difference in patient care and just demonstrate expertise, and that's a huge honor.
It is a huge honor, and I was very proud to accept this award with the hospital.
Again, congratulations.
Thank
it's something really
much.
to be proud about. Well, let's get into this stroke. What is stroke? What causes it, and what are some of the symptoms?
Well, a stroke happens in the brain. It is a lack of blood supply to a part of the brain, and most of the time it is caused by a little blood clot. Sometimes, more rarely, it's caused by hemorrhage and bleeding in the brain. So when this happens and a little blood clot blocks the way to the brain cells, people experience a stroke. A stroke looks like pretty much somebody draws a line through half of your body, and half of your body is not working anymore. So symptoms of stroke that are very common are numbness, weakness, paralysis on one side of the body. It could be the face, the arm, the leg. And some people experience headaches, vision problems, or sometimes they're a little bit off with their gait and balance.
Well, what are some common myths about stroke? I know growing up I thought it was a term that was synonymous with a heart attack, for example, as a kid. What are some common myths?
Well, we actually call it now brain attack, just like people are familiar with heart attacks. And some common myths are people think that stroke happened to only the elderly. It actually happens to some young people as well, pregnant women, children sometimes. And it can really happen at any time. And some other common myths are the fact that we cannot treat a stroke. People think that once you have a stroke, that's the end of it. Well, let's see what we can do. But the actuality is that we have a treatment for stroke, and stroke is an emergency. You need to present to the hospital as soon as possible. It's a very short window of 3 hours to give medicine and to reverse that stroke.
Yeah, I've heard that that is the key, actually, is getting to the hospital within that 3-hour window. How does that medicine work, or why is that real? I mean, we need to stress that to people, why that is so important.
Well, we just said that a stroke is caused by a blood clot in the brain, and so that medicine works for that kind of stroke, and it literally eats away the blood clots in the bodies. Not everybody's a candidate for it because there's a risk of bleeding, but this is a wonderful medication that reverses stroke and can actually reverse it completely and bring the person back to their prior functioning.
Well, say we're with someone who has a stroke. What are we going to notice visibly? I know you talked about the paralysis and the different lack of movement, but is there something that's going to tell them this is really something we need to act on now?
And that's actually a problem with some of our stroke patients. They do not realize this is actually happening to them. So we really need to educate the community out there and let them know that if you see someone around you that has weakness on one side of their body, they may have some speech difficulty and trouble understanding or bringing out their speech. So anytime this would happen to someone around you, you would call 911 automatically and get to the hospital as soon as you can.
Well, are there any groups that are maybe at a higher risk than others?
Actually, yes. Women are at more risk for stroke, and more women die of stroke than actually breast cancer. But also African Americans are at really high risk for strokes.
Well, so why can't some people identify this and get to the hospital on time?
Well, for a heart attack, for example, people have pain, and they experience pain, and they react pretty quickly and get to the hospital. But for a stroke, you may not experience that pain, and you may have some numbness, strange symptom, your speech may not come out correctly, or just some weakness on one side. And so people kind of think, I'm a little off today and I'm going to go take a nap, or they don't tend to react as quickly as a painful event.
Okay, well, that's great information. Well, are there screenings available or other type of education similar to what we educate about other
Absolutely.
issues?
There are lots of screening in our community, and West Florida certainly does this once a year, where we offer free labs to the community. They get to have their lipid profiles and their diabetes test just to see if they're a diabetic patient. But we also offer education constantly throughout the year at West Florida Hospital, and patients can check with our hospital and call the main line and get information on more seminars and lessons, classes.
Now, with that information, I know it's good to have and it's probably reassuring to those who have positive outcomes, but is this something that then they need to take back to their primary care physician and have on file? What kind of conversations should they have with that doctor?
Once you have a stroke or just thinking about stroke, you should always talk to your primary care physician about your risk factors. And another myth about stroke is that once you have one, you are actually at risk to have more strokes. So you always need to get back to your primary care physician, check with them, make sure your blood pressure is under control, your cholesterol levels, if you're diabetic, that your blood sugar is under control.
Well, what are some of the causes of these clots which turn out to be a stroke?
And risk factors that I just mentioned, the number one risk factor is actually blood pressure. Okay. Uncontrolled blood pressure is the first thing. And then you have cholesterol level that is too high, people that smoke, and this is the number one thing that people can actually do to change and make sure that they stay away and prevent strokes. And diabetic patients need to make sure their blood sugar is under control.
So there are some proactive steps as far as lifestyle, diet, and things like that that people can do to try to prevent this situation from happening. Well, what about support groups?
Actually, West Florida Hospital is the only hospital in the community here to have a support group. And we have a wonderful group of people, and they meet once a month. They have a little seminar at the beginning of the group, and then they kind of get to mingle and exchange experiences and tips for one another, and it's just a great experience for stroke survivor, but also their family members and their caregivers.
Well, thank you for being here. That's great information, and you're serving a large segment of the population, as you say, their families. So thank you very much.